Hello, this is my summary of somatic symptom disorder from the DSM V TR. Somatic symptom disorder is when there is an extreme focus on pain or fatigue, which causes issues in functioning and major emotional distress. The criteria specifies that somatic symptoms cause distress or significant disruption, and there are excessive feelings, behaviors, and thoughts present that lead to at least one of the mentioned. Persistent, disproportionate thoughts about the symptoms' seriousness, a high persistent anxiety about the symptoms, and excessive energy or time devoted to these symptoms. The state of persistent somatic symptoms occurs for more than 6 months, even if one of the aforementioned are not presently persistent. Specifiers to consider include having predominant pain, where lots of pain is described to be present, and persistent, where symptoms occur more than 6 months. Severity is specified as follows. Criterion B is fulfilled for at least one symptom, which is thus called mild. 2 or more symptoms present are called moderate, whilst more than that is severe. Features associated with somatic symptom disorder include an intolerance of bodily complaints and a self-concept of bodily weakness. They have the tendency to seek repeated medical bodily checkups to look for abnormalities. They also tend to avoid physical activities. Somatic symptom disordered individuals have frequent requests for medical help and reassurances from the doctor, though these reassurances tend to be short-lived for the individual because they regardless do have the perception that these issues or injuries or whatever symptoms are serious and that the doctor is not taking them seriously. A focus on somatic symptoms is a primary feature of somatic symptom disorder. The prevalence for the disorder is obscure, with estimates ranging between 4 to 6% of the adult population. The 12-month prevalence in primary care patients was between 10 to 20%. In addition, women report more somatic symptoms than men, and thus they make a higher prevalence rate. In terms of cause and development, age of onset does not affect duration of the untreated illness. The course tends to be fluctuating and chronic and is influenced by personality traits pertaining to greater cooperativeness and less harm avoidance, which can shorten time to remission. Children with somatic symptom disorder tend to have a single prominent symptom that leads to increased impairment, school absenteeism, distress, and medical help seeking. It is important to obtain family, patient, and school sources of information. Older adults with somatic symptom disorder tend to have pain localized in many bodily regions and comorbidity with an actual medical illness. Risk factors include negative affect, comorbid depression, and anxiety. All of these are examples of temperament that can exacerbate the symptomology of somatic symptom disorder. Environmental factors such as early lifetime adversity, childhood sexual abuse, few years of education, being of a low socioeconomic status, and recent health-related or stressful events are correlated with somatic symptom disorder. Being of the female gender, having depression, anxiety, and medical illness was correlated with total somatic symptom severity. Heightened attention to bodily sensations and bodily symptom attribution to a medical illness were examples of cognitive factors that exacerbated clinical course. In terms of culture, stigma can make it difficult to convey somatic symptoms, and some differences are present due to differing cultural contexts. Females are more likely to report severe somatic symptoms than males. In both, this tends to be related to intimate partner violence, childhood trauma, adverse experiences, or severe trauma history. Gender was associated with increased likelihood of developing persistent symptoms of somatic symptom disorder. Somatic symptom disorder was also correlated with suicidal attempt and thoughts and overlapping comorbidity with depression symptoms. The severity of somatic symptoms and dysfunctional illness perceptions was independently correlated with an increased risk of suicidal ideation. Functional consequences of somatic symptom disorder include high psychological distress, marked impairment of health status, and impaired health status scores were larger than 2 standard deviations below population norms. Somatic symptom disorder was comorbid with depression and anxiety by 50% of cases. PTSD, OCD, sexual dysfunction in men, as well as poorer quality of life, and overall functional impairment. Somatic symptom disorder also worsened disease, reduced treatment outcomes, and increased the use of healthcare services. So yeah, that's pretty much somatic symptom disorder in a nutshell. Thank you very much for watching. Bye-bye.